Next question will go to Pat Healey with the Laker.
Hi, this question is for Dr. Strang. On Friday night, a letter and email went home to parents and guardians at HRH about a case-connected COVID case. And then it said that testing for all students and staff. A couple hours later, the letter, corrected notice went home saying only the close contacts. What led to that change?
So there was some miscommunication from public health with us. I'm working with the school administration. When we identify when we work in a school, it's the identified close contacts that we recommend for testing. The other ones just are not necessarily recommended. It's not that we recommend testing, but like everybody else in the province, we're saying you should consider getting asymptomatic testing. So there was just a bit of miscommunication there, unfortunately.
Go ahead with your follow-up, Pat.
This next question for Premier Rankin and Dr. Strang. With how many gatherings there was this weekend over the limit, how disheartening is it to see that?
Well, I think, thanks, Pat. I think you saw how disheartening it is for me, and I do still have faith, though, that Nova Scotians, when they understand the seriousness of the issue, that they will act accordingly. This is a select few people, hopefully, that are going to start getting the message more and more. We just have to start thinking about our loved ones a bit more, and hopefully we'll see some better compliance in the days and weeks ahead.
And that's all the time that we have today for questions. Go ahead, Premier.
Thank you. Like Dr. Strang, I am worried about the number of patients infected with COVID in our hospitals. 42 people who cannot manage their health at home, and now 8 in the ICU. Today, I've spoken with Dr. Ward Patrick, head of critical care at our health authority, where everyone is working hard to manage the increase in hospitalizations at the QE2. He's worried too. Doctors and nurses have told us this third wave is different. Younger people who are otherwise very healthy are being admitted this time, and they are much sicker than the first wave. Imagine not having the energy to walk and talk. Imagine not being able to get out of the bed or lift your head off the pillow. Imagine not being able to breathe on your own without a ventilator. Now stop imagining. This is what some patients infected by the variants are experiencing at this very moment, and they are now fighting hard in the hospital. I'm worried about them and their families. We wish all of our current patients a full recovery, but it is a reminder that the variants do not discriminate, and we need to be careful, and we need to protect each other. Today is the last day for the MLA for Annapolis. So to my former boss, friend, and mentor, former Premier Stephen McNeil, I want to thank him for helping protect all of us in the first and second wave. And of course, my best wishes go out to him and his family, his wife Andrea, and Colleen and Jeffrey. Remember today how he reminded all of us to work together, to be kind to one another, and to follow public health protocols. And when enough people ignored them and continued to gather and socialize, remember what he told us. Stay the blazes home.
Can I also say to Premier McNeil, thank you, sir, for your service to this province. It's been a privilege to work beside you.